Doctors of Reddit, have you ever seen someone outside of work and thought, wow, that person needs to go to the hospital now? What were the symptoms that made you think this? My boss was taking her daughter to visit her father, who works as an emergency nurse in another city. The daughter had been feeling unwell, but downplayed her symptoms to avoid cancelling the trip and insisted on coming with her mum to pick up the father from work rather than staying in the hotel to rest. The father finished his shift and comes out to meet them in the car park, and as soon as he saw the daughter, went straight back into emergency mode, whisking her into the hospital and barking orders for IV fluids etc. The daughter ended up having bacterial meningitis and was going into septic shock. It was pretty serious and she nearly died a few times but eventually pulled through. If she had waited back at the hotel she probably would have died. Meningitis is terrifying. Totally fine to dead in less than 3 days, and it often happens to young and healthy people. I was so glad when the vaccine for viral bacterial meningitis was developed, so at least I only had to worry about one. I was puking bile during flu season and had a slightly raised right side. After about a gallon of bile I told my mom, who works in the ER, that I needed fluids. So she brought me in for an IV. Good thing we went, because I had a massive tumor on my liver. It was close to bursting because it had outgrown its blood supply. When it was removed it broke apart like a rotten piece of fruit. That began a 5-year saga of living in hospitals and eventually led to my transplant in 2009. Celebrated my 8th liveversary this past September. Yay, happy endings. Another time I'd puked in the sink in the dark. Only made it to the sink and was going to rinse it and go back to bed, but something told me to turn the light on. Good thing I did, as I'd had an esophageal varus burst and had puked up a lot of blood. That's how we found out I had varices. Jesus. My mother-in-law is a doctor. We were in Disney World of all places and having dinner when she got up from our table without a word and walked to the table across from us and started yelling to the waiter staff to call the paramedics. She literally diagnosed or recognized the signs of a heart attack happening to someone by watching them and even gave them the baby aspirin sublingual nitroglycerine tab meds, most likely to be aspirin, though possibly nitroglycerine. Unlikely to have been gasoline. She carried in her purse in case that ever happened. Then she stayed with them till the paramedics came. It was surreal. I'm sure it's the kind of thing that would have been apparent even without her minutes later, but it was crazy to see her do that. I used to babysit this girl, and was really into photography at the time, so would always take pictures of her, with parents' permission. After a year or so I noticed that in any picture with flash, where you would expect red eye, her left eye would be white instead of red. I mentioned it to her mom, who mentioned it to the doctor, and sure enough, she was something like 90% blind in one eye. She always passed her school eye tests by doing the other eye first and memorizing the chart. Clever girl. I'm not a doctor, but I used to be an EMT. At gas stations on 2 separate occasions, I ran into a stroke and a hypoglycemic stupor. The stroke was trying to get the cashier to call 911. The cashier didn't understand because of aphasia. Her mouth couldn't make the words her brain was telling her to. The hypoglycemic stupor was similar. The dude had stumbled into a shelf and was trying to stand back up while also looking for food. Both cases were obvious to the trained eye, so all I did was tell the cashier to call 911 and what to say to them. Doctor here. Had a cousin message me on Facebook complaining of neck pain that was worsening, a massive headache and a fever. Told her to get to the ER immediately. She was diagnosed with meningitis and was hospitalized for 2 weeks. I had meningitis as a kid, and apart from a giant haze of days and nights passing without meaning and being forced to drink fluids, the thing that sticks out in my memory is the neck pain. Holy crap, I will never ever forget that pain. Just accidentally putting my chin down ever so slightly was enough to make me see stars. Definitely not a doctor, but I was a forensic death investigator, which really doesn't normally line me up to see living people very often unless they were co-workers. But I remember I was at a scene in a bad part of town, a suspected OD at a drug house. Of course a bunch of people were rubbernecking and one of them was a guy that was clearly a user. He had track marks and skin popping cellulitis, skin infections from IV drug use. But what was really shocking is that he had necrotic fingers. All the fingertips on one hand were dead and black, but his pink and ring finger were black all the way up to the hand. I'm no doctor, but I've seen these conditions before on people that showed up at the ME's office. After getting the scene under control, I went and had a polite word with the gentleman and explained that he needed to seek medical attention promptly. I told him about the local county hospital that's low cost, doesn't require insurance, and will treat him without judgment. He just nodded, said he'd think about it, then asked when the house would be open again cause that's where he lived most of the time. My mind was just blown. Well, be seeing you later. Doc here. Honestly, the most frequent thing I see in real life is untreated anxiety and depression. And the number of people who are eating too much or drinking too much or watching TV 6 hours a day instead of going to therapy or getting on a medication is really astounding. Now, I love eating crap food and drinking and watching TV, but a lot of people use these as coping mechanisms that we just kind of accept as normal in our society. If only therapy cost the same as gas station liquor and shared Wi-Fi. Happened to me as a baby. My uncle came by for a visit, who is a doctor, noticed I didn't look quite right and needed to go to the hospital immediately. As he correctly saw it, I had a pretty severe case of jaundice. Not a doctor, but was waitressing once and a doctor came up to me from across the room and told me to go to a surgeon about the lump in my throat. Honestly, wasn't even that noticeable. It's where an Adam's apple would be on a nail. I told him I'd gone to my doctor who said it was benign and he insisted I go to a specialist regardless. I did, and it was stage 2 thyroid cancer. Not a doctor, but my dad is, and this is his story. As a background, he has been practicing medicine for decades, now in his 50s, and is also a lifelong mountaineer. He has been the expedition doctor on many mountain climbs and has even written an article on high altitude medicine that has been translated into a load of other languages. So he was up a mountain in France that had a cable car. I believe it was the Aiguille du Midi, altitude 12,604.99 featuring or 3,842 meters. He noticed a lady with all the symptoms of AMS, acute mountain sickness, where some people are unable to go above 810k featuring 2,500 m, without experiencing dizziness, shortness of breath and other such things that happen when the brain is not getting enough oxygen. The lady and her partner were in the queue to get down the mountain, but it was a big queue and taking a while. So my dad ended up in an argument with the lift attendants trying to get the poor lady down to safe altitude. She got down fine and her partner waited around 4 hours for my dad to come down to buy him a meal as thanks, if I recall correctly. She didn't need hospital, but if she had stayed up there for much longer she really could have, and AMS can get really serious. Just one of his many stories. I've been trying to get him to write a book. You'd think lift attendants working on a mountain would have some idea of AMS. Not a doctor, but my neighbor, who I hadn't really met before, slipped on her porch and hit her head on a cinder block acting as a step. She went around to the neighbors at 11:30 p.m. asking to borrow a phone to call her husband, who had taken the kids to see a movie. No one would let her use their phone, so I did. She was slurring and having trouble keeping focused and kept looking like she was going to pass out. I kept insisting she go to the hospital and I'd drive her, but she kept telling me she was going to wait for her husband. Her roommate was with her, so I kept pressing them too, but no one wanted to make a fuss. She had a couple beers around 8 p.m, so to me that seemed like she'd probably not be that drunk so long later after just 3 beers. I waited with her until her husband came home, told what happened, and, again, insisted she go to the ER. After consideration, they all decided to wait and see in the morning. I regret not just demanding her to get in my car and go. She went to the doc the next day, and there was apparently some bleeding in her head and she now has some likely permanent damage from it. Apparently she was lucky to still have been alive. I didn't know her at all. I should have just made her go. Not a doctor, but a good story. My dad has giant bulging eyes. It's just how he looks, and we all have giant eyes in my family. On multiple occasions my dad has had people come up to him in public and ask him to see a doctor about his eyes. He has before, and he's fine. We're just a strange alien family. Nurse practitioner here. I was a timer at a club level swim meet and noticed a 15-16-year-old teen who was about to race with an irregular shaped, multicolored lesion that was at least 1 centimeter in size. I tracked down her parents and expressed my concern and recommended she see their family doctor. They were from out of town, so I never found out if they followed my advice. I'm still a med student, but the scariest I saw was a young guy who suddenly collapsed during a running competition at my faculty. Luckily he was back quickly on his feet, but sudden syncope in a young healthy athlete is a serious sign of cardiac pathology like arrhythmias or a genetic heart disease. The guy who collapsed was diagnosed with a dangerous arrhythmia, Wolff Parkinson White, and was lucky to survive. I collapsed at work and was diagnosed with WPW. Got an ablation right away and I'm perfectly healthy. Modern medicine is awesome. Not a doctor, but recently witnessed a lad go over the bars of his bike. Stopped to help him. He was so stunned he didn't realize he dropped his phone till I handed it to him. I tried to get him to rest a while, but he insisted on riding off. Luckily I spotted a police car and described the lad and his bike to them and said I didn't think he was fit to proceed. They went in search of him. I hope they found H and gave the necessary medical attention. I'm a nurse. I had a friend who had this headache, like really intense. He had to cover his eyes with his hands because he couldn't deal with the light. When I asked him to move his chin towards his chest, he couldn't do it. Then he started to feel like he needed to throw up. That's when I knew. Meningitis. I've always heard this as a danger sign from my parents whenever I feel bad. So now anytime I have a combination of sore neck, typically from yoga circus aerials, and get a cold, I'm always petrified. Still better than not knowing, but it also incentivizes me to get massages whenever I have hard workouts to eliminate that as a potential confusion. Obligatory. Not a doctor, but I work in mental health care. There's a phenomenon you often see in women having manic episodes that you'd call manic makeup. In the middle of the day they'd look out for a night out and don't recognize this isn't a normal look. Normally when you see this, people are already really ill and need care. I was in the local supermarket in the middle of the day when I see a woman who looked like she was fresh out of a Rocky Horror performance. Otherwise was acting absolutely fine for being at the supermarket, but the makeup seemed like a dead giveaway. Didn't want to say something to her on the off chance I was about to majorly offend someone perfectly well, but overzealous with her eyeliner and blush. Went into work 2 days later to find she was under a psychiatric hold in the facility I work in. That's really interesting. I don't work in any kind of healthcare, but I've noticed it too. People tend to laugh at it, think Amanda Bynes, but it's a pretty clear sign that someone's not okay. Not a doctor, but when I met a friend's family for the first time a few years ago, I was surprised because her brother looked like Andre the Giant, whose distinctive appearance was acromegaly, caused by excess growth hormone. I didn't say anything because I didn't want to rudely comment on his appearance. Found out this year that he's being treated for a pituitary cancer. It sounds like he'll be okay, but I wish I'd been rude and said something earlier. Firstly, the obligatory. I'm not a doctor. I used to work as a math tutor primarily with kids in elementary school. I've had pretty serious OCD as long as I can remember. I was helping out an 8-year-old one day and she started talking about how she counts her steps. I started asking her about things similar to my own symptoms. By the end of the lesson I had checked just about every box on the OCD checklist. After the lesson I had a talk with her mother and explained the situation and recommended she talk to a doctor. This was a surreal experience, being a 19-year-old who's anxious to start out with trying to explain to a mother of 3 that one of her had the same thing that I struggle with. I know the feeling. I literally just heard someone talk about how they are so stressed and can't sleep, and my instant thought was get to a freaking doctor, my friend. It sucks knowing that if they don't listen to you it just gets worse. Not a doctor, but I am an optician who takes his job very serious, and this is about a patient I sent to the hospital from my office. A patient who picked up her glasses the month before called complaining of very recent spout of seeing double and getting a headache from it. Had her come in that afternoon to check her out and she needed a somewhat surprising amount of prism in her glasses. But sometimes it's easy for doctors to overlook that component when they do the exam. I rushed her glasses so she could pick them up the next morning. When she picked them up she said it was a complete relief and left. Next day she called saying she started to feel the same thing again. The optometrist was out, but I had her come in anyway because it seemed really weird and there were some big red flags popping up. So, I'm not authorized to do examinations or diagnose, but I know enough that I could probably open a place across the border and do everything. We threw up a couple lenses and determined the change from a coupe days before had doubled. Called the doctor, come in immediately to check it out. Doc noticed the same thing and we called immediately for an ambulance to take her to the hospital. Aggressive brain tumor next to the nerves for eye movement. They gave her a month to live, but we caught it early enough that she lived for 5 more months. I've worked with some doctors on 3 different medical mission trips, 1 in Haiti and 2 in Guatemala. Seemingly every 4th or 5th person that walked in the door over the age of 40 had something wrong with them that would have sent them to the hospital immediately in the States. I took blood pressures and blood sugars on the Guatemala trips, and we would regularly see people with blood pressures of over 180 and or blood sugars of over 300. Even had some people with blood sugars of 500, 600 or higher, and yet they'd just be walking around like nothing was wrong. Half of these people should have been dead with measurements like that. This kind of stuff happens in Mexico too. I'm currently an intern at a public hospital on the 3rd biggest city in Mexico, and people just come with that, and they sometimes even refuse treatment or argue with the staff because I can't be diabetic. You're wrong and you know nothing. Finally a thread for me, not me, but my parents, and they are not doctors, but lawyers. But that's not important. When I was a toddler, I loved carrot juice. I drank it a lot and actually started to turn yellow. My parents noticed at some point and took me to the hospital immediately. The doctor looked at me and asked, "Why is your kid yellow?" My parents didn't have anything other than, "Actually, that's what we wanted to ask you to offer." But sure enough, when they stopped giving me carrot juice, I slowly looked normal again. I turned orange when I was a baby, too. Apparently I loved carrots and sweet potatoes. I'm just a medical student, but I recently saw someone on the bus who looked like a textbook case of advanced Cushing syndrome. Flushed and moon-shaped face, buffalo hump, fatty tissue between shoulder blades, hirsutism, fresh striae, thinned skin, central fat distribution with slim limbs. Doesn't sound that distinct, but the presentation jumps out at you with Cushing's patients. It's often caused by a pituitary adenoma, which is not uncommon, and the patient is unaware it's even there. I didn't approach her because 1. I'm just a student. I could be very wrong. 2. Cushing syndrome is a common corticosteroid side effect. She could already be aware of it and it would be hurtful for me to point it out. I do wonder what happened to her. I was in Chicago and literally was forced to step over a homeless guy whose shin was broken and pointing at the wrong angle, and the skin was very off color. I'm from a country with universal healthcare, so my first thought was get to the fricking hospital. You should have called 911. They'd have treated him. All the time. As a physician, every time I walk to, say, Walmart, I'm very inclined to talk to people about their condition and seriousness of it. It doesn't have to be a very specific symptom, but just by the way they walk, talk and stand up I can usually detect some common risks that are associated. I've said it before and I'll say it again, Walmart and similar stores are great places for health control centers. This is the most doctor sounding comment on here. I'm not sure if this counts because while I wasn't at work, but I was volunteering in a professional capacity at a youth tournament. It made for weekend of some concussions, a mild fracture or 2, a few kids who needed stitches, but mostly handing out ice packs, taping and calming down worried parents. I got called over to a distant field, so one of the medics who was volunteering with me and I putted over in this cool vehicle that's like a big ATV with a truck bed that the ambulance service had modified to carry the equipment and could haul someone. Anyway, we get over expecting to find a bad bruise or something mild, since the referee called us over with a walkie-talkie and didn't sound serious. Nope. This kid is on the ground curled into a ball and was in so much pain he was past the point of screaming. If you've never been in that amount of pain, count yourself lucky, and if you have, you know exactly what I mean. This kid can't tell us what happened, but the coach and his dad said he has taken a stick to the left upper quadrant, but that it wasn't that bad of a hit, and the coach seemed to think the kid was exaggerating. Well, we try to do the best exam we can, but we're suspecting a cracked rib. But as we're starting, the dad mentions that the kid has mono and wasn't cleared for contact yet, but the coach, dad and kid all didn't think it would be a big deal if he played. For those of you who don't know, infectious mononucleosis has a nasty habit of causing swelling of the liver and the spleen. This sometimes can cause splenic rupturing. It can happen even without any trauma, hence why sports and mono don't mix. Needless to say, taking a stick to the spleen is bad news bears, and suddenly the whole situation became a lot more serious. No one likes a ruptured spleen. Moral of the story, listen to your doctor when they tell you not to do something. Jesus. My co-worker died on the table several times and was resuscitated after a ruptured spleen. They honestly thought he wasn't going to make it. He had mono and a doctor pushed too hard during an exam and, yeah, bad. Guy at the gas station coughing and sputtering, bringing up major mucus. Looked like he was about ready to pass out, but he was going to finish that cigarette. Given the gas and the cigarette, I didn't stick around long. My mum's a dialysis nurse. When my nephew was born, my brother was sending us pictures of him. My mum noticed that baby was looking jaundiced, so she told them they needed to head back to hospital. They promptly did. Jaundice in newborns is fairly common though. It isn't necessarily an abnormal finding, but should be followed up on. A relatively junior surgeon here. I have some very dodgy neighbors in my building and I am convinced the flat below me is dealing H through their letterbox to rough looking folk who hang outside their door. One morning I noticed a woman struggling up the steps to the flat clutching her groin. Working in one of the more deprived parts of the UK, I have seen a lot of H addicts develop horrendous groin abscesses or false aneurysms. I've even seen a couple die from the resultant complications. This woman's pained gait and disheveled appearance was absolutely classic for this. She needed a CT angio and a vascular review at the very least. I didn't say anything to her. I really should have. Not me, but a few years ago, there was a doctor in my tennis group. We were playing doubles, and one guy, who historically has handled the physicality pretty well, seemed perpetually out of breath. Dr. Tennis Player said it was very disconcerting and he should see someone ASAP. He did. Arteries were clogged and he underwent bypass surgery not long by after. Not a doctor and late to the party, but I do have a story of someone avoiding the hospital when they definitely shouldn't. Obviously this is a throwaway. Anyway, story begins with this guy, let's call him John, who's in my grade, high school. I didn't really know him too well until after he came back from his junior year abroad, but now that he's back I've discovered we have a lot of mutual friends. Heard about this through one of them. John is a bit of a druggie. Drinks, smokes, probably some other stuff too. Not too uncommon in high school, but still not a great idea before you've graduated. However, this pales in comparison to something he did about 2 weeks ago. John decided to get a tattoo. That's fine, I'd like one too someday. However, he decided to give it to himself using a tattoo gun he got from a friend and which he did not sterilize. Bad enough. But John also decided to use this tattoo gun to write the word ego on his dong. Impressively, he succeeded. About a week later and a mutual friend tells me that John is now downing pain meds. I have no idea how he got them, not prescription, at incredibly high volumes every day because he has gangrene. His dong has gangrene. This could mean he could lose his dong, and to my knowledge he still hasn't gone to the hospital. But I'm guessing you wanted physicians to answer this, but since that isn't what you typed, I saw a minor accident late one night and drove up to offer assistance. Young man about 20 is behind the wheel and was swaying from side to side. I put my hand on his shoulder and asked him if he was okay, checking for shock. In a loud voice, he was sweating profusely through his clothes. He had a 1,000-yard stare. He could not make eye contact with me. He was more or less unresponsive, though apparently semi-conscious. Face was flushed. I'm not that sort of doctor, so I called the professionals for him. If I had to guess, I'd say he was mixing alcohol with C. I don't believe he incurred any injury from the accident. Was probably more of an effect than a cause of his behavior. Cousin posted on Facebook about how her husband had been feeling sick and went to the chiropractor, threw up immediately following his treatment, and now his eyes were no longer tracking together. I freaked. Thankfully someone already correctly pointed out that he was likely having a cerebellar stroke. He was bilateral vertebral artery dissection from aggressive cervical manipulation. It seriously messed him up. Doesn't happen very often, but it happens. Don't ever let a chiropractor touch you above your shoulders. I would look out the windows of gym every day and see this same man walk up the street, morbidly obese, using a shopping trolley to help him walk. Ulcerations all over his skin including his face. His whole body looked like it was eating away at him. I always remember thinking, please God don't ever let me see him collapse. Another not me, but one of my professors was a neurologist. He told us he used to stroll down the street with his neurologist friends and they'd diagnose some specific conditions based on the way people were walking. He refused to demonstrate this for the class, though. Just last week I tried to describe one of the dog park regulars as that lady with Parkinson's disease in the yellow lab. Shockingly, that wasn't enough of a description for my non-medical so. Not a doctor. I was on a plane from Philadelphia to Nassau. I was the aisle seat, and there were 2 men in my row. The guy with the window seat was overweight, 65 plus, with a CHF sounding cough, and looked like death warmed over. The flight was about 3 hours long. As soon as the seatbelt light went off, the window seat guy was up every 15-30 minutes to go to the washroom. When he'd come back he'd sit back and almost immediately start obstructive snoring. Then he'd snore, wake himself up and then need to go to the bathroom. I was watching him like a hawk. My thought was he's not going to be alive in a year. I wonder does he know that? If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.